Today, I'm declaring a state of emergency in Massachusetts. This declaration will give our administration more flexibility to respond to this evolving outbreak. In addition to the state of emergency, our administration is moving forward with enhanced guidance for employers and large organizations. Responding to this evolving health threat requires everyone to be vigilant and for everyone to be part of this effort. In addition to practicing good personal hygiene, we all must consider how our actions and choices as employers, community leaders, workers, and residents can help mitigate the impact of this disease. Today, we're here to outline new protocols for executive branch employees. The Commonwealth is one of the largest employers, and so we have a significant role to play in mitigating the spread of this virus. And we urge all employers and large organizations to follow suit where it is appropriate for them to do so. But before I get into the details on the enhanced mitigations efforts, I want to discuss why it's so important to take these steps now. At this time, the number of people infected and requiring medical attention is very much within our healthcare system's capacity. The number of people in isolation and sick right now has minimal impact on commerce. The purpose of moving forward with these measures now is to act before the numbers increase to a point where the virus spread is severely impacting the Commonwealth. The highly contagious nature of this disease means that if everyone plays their part in slowing the spread, the number of people who become infected and require medical attention doesn't spike all at once, which would overwhelm many of our systems. We understand that asking people to change their habits, cancel some events, and cancel travel is inconvenient, and we also understand that it comes with a financial impact. But waiting to act and allowing infections and the subsequent number of people who need medical attention to spike all at once will not only severely hamper our hospital's ability to care for patients, but will have a far greater economic impact as well. This enhanced guidance we are announcing for executive branch employees prohibits nearly all work-related travel, limits or cancels large events, and encourages teleworking wherever appropriate. Starting tomorrow, the following guidance will be in effect for the executive branch workforce. All work-related travel, both foreign and domestic, is to be discontinued until further notice. We will also strongly encourage that executive branch employees avoid any personal international travel. Conferences, seminars, and other discretionary gatherings hosted by the executive branch agencies involving external parties are to be held virtually or canceled. Regular internal business shall continue, including but not limited to mandated public hearings and board meetings. Meeting organizers are encouraged to utilize alternatives like conference calls, WebEx, and other group communication tools. Additionally, employees should not attend external work-related conferences, seminars, or events. As an alternative, employees will be encouraged to participate remotely. Finally, as previously communicated, employees feeling sick with fever or flu symptoms should not come into work. Information available to date regarding COVID-19 indicates that the highest risk population includes older adults and individuals with chronic medical conditions. Employees in this risk group are encouraged to talk with their supervisors to review possible alternative work assignments. Each of the above measures will be revisited in 30 days or sooner as circumstances dictate. We believe it's important to start taking more aggressive action now to mitigate spread based on the information we have available. There's no question that the efforts to mitigate the spread of this virus will be disruptive. We expect this disruption to continue for the foreseeable future and understand it will cause inconvenience for many. But our goal needs to be to significantly increase efforts to mitigate the spread of this disease now. We are seeing an uptick in presumptive positive cases in other parts, in part as a result of increased testing. More cases will be reported in the near future as more testing is done. This is a serious disease, particularly for older residents, and especially for those with pre-existing health conditions like respiratory disease, lung disease, and heart disease. The reason we're moving forward with this enhanced guidance is to mitigate the adverse impacts that large numbers of infections could have on our healthcare system, our communities, and those individuals who are most prone to this particular illness. As we have said before, for the vast majority of people who contract this disease, it is not deadly. And the latest research shows that children and young people are at an especially low risk of health complications. But we must step up these mitigation efforts to avoid large numbers of people requiring medical care all at the same time. This way, our healthcare facilities can continue to provide the world-class care that they are currently providing. And as I've said before, everyone has a role to play to stay healthy, and that's why I urge employers and other large organizations to follow our example where possible, limit or eliminate non-essential travel, limit or eliminate large events where possible, and explore telework where appropriate for your organization. I want to be clear that state government will continue to operate uninterrupted. We will continue to serve the needs of our residents. Required public meetings and other government functions will still take place. Our secretaries, commissioners, and directors will constantly evaluate how to balance serving the people of Massachusetts with implementing these mitigation efforts to slow spread of the coronavirus and other germs. I know everyone will have a lot of questions, such as how our policy relates to large events like professional and other sporting events. What we just outlined are requirements for the executive branch, and we believe the private sector and other large organizations should follow them where appropriate. But on sporting events, we're urging older adults and those with health issues to avoid large crowds and large events. People who live in households with vulnerable people, like elderly parents, should also consider avoiding large crowds. We believe that Mayor Walsh and Congressman Lynch and the organizers made the right call to cancel the St. Patrick's Day Parade and breakfast in South Boston. Regarding the marathon, it's still over a month away, and we continue to discuss this with the City of Boston and with the BAA as we get closer to that event. With respect to riding the T, again, older adults and those with underlying health issues should avoid large crowds if possible, but we also understand that many of these folks need the T to get to where they need to go. That's why the T is working to disinfect surfaces and vehicles across its system. With respect to K-12 education, the Department of Elementary and Secondary Education is providing local schools with relief from attendance and school year requirements so that school districts have the flexibility to make decisions on temporary closures due to coronavirus concerns. More specifically, the longest that any school district will be required to go is its scheduled 185th day. No schools were required to be in session after June 30th. For accountability purposes for school year 2019-20, DESE will calculate chronic absenteeism as of Monday, March 2nd, 2020, and disregard all attendance data for the remainder of the school year. Commissioner Jeff Riley is strongly urging all districts to cancel all out-of-state travel at this time. This is in addition to our existing request for schools to cancel international trips. The Department of Public Health will be issuing updated guidance to superintendents on how to address cases that arrive at a school, including potential school closures. China and other countries that saw early outbreaks are making progress in pushing back against the disease. But it's only possible if everybody plays their part. And it's only possible if step-up mitigations happen now. Coronavirus is a rapidly evolving disease. We're fortunate to have the resources and expertise of our talented public health officials and world-class healthcare providers and hospitals to support the Commonwealth in battling this disease. And we urge all of our residents to do their part to stay informed, to keep the Commonwealth safe and healthy.